Thank you, everybody, for taking the time to join the call today. We'll go ahead and get started. We'll be talking today about the PIH Notice 2021-34 regarding the Expedited Regulatory Waivers. Before we get started, I want to go ahead and introduce a few folks who are on the panel who can jump in and respond to questions at the end with me. On the call today, we have Velma Bryan from the Public Housing. She's the Public Housing Director for the Birmingham Field Office, accompanied by both Angela Davis and Deborah Bean, who are the Division Directors for the Birmingham Field Office as well. Velma, do you want to kick it off and do a little intro for us?
Okay, yes. Good afternoon, everyone. Again, we apologize for the delay. I just want to give you a brief greeting on behalf of Tasha LaShore, the Regional Director for the Southeast Network. We hope that this afternoon training is beneficial to you for our shared goals of housing more families and utilization. This notice provides a great opportunity that we've never seen before in regards to a lot of aspects. So enjoy the training and thank you.
All right. Thank you so much, Velma, for the intro. So we'll go ahead and get started. So this training is supported through an agreement between, a collaborative agreement between CVR Associates and HUD has been very supportive throughout the development of this presentation. So the Birmingham Field Office has been awesome working with to put this together. So I hope you guys all learn and enjoy some things from this. So as it relates to our agenda today, we will go through an introduction of what we have going on, as well as talk about the PIC notice, and then we will review the waivers, talk about the impact of using the waivers, followed by questions and answers and wrap up. And so today's training is set to discuss how PHAs can improve the Hcv utilization of their programs through the implementation of the PIH Notice 2021-34, which references the Expedited Regulatory Waivers for the Public Housing and Housing Choice Voucher programs. In addition, we will review the flexibilities, how to apply for the different waivers, and how to analyze the impact and adoption of these waivers will have on your HCV's utilization. As most of you know, utilization is a very important topic as it relates to the Housing Choice Voucher program. It is what is known as a wildly important goal by HUD, which is also known as a new acronym you can use as a WIG. And so these waivers are set to help improve utilization of programs, as well as assist, and more importantly, assist the families that we're serving to maximize the number of families we can provide housing to. I'm the webinar facilitator. My name is Mike Edens. I'm a vice president with CVR Associates. I've been in the housing industry for 17-ish years. I've got a variety of experience as it relates to Cmap, different HUD guidelines, the Housing Choice Voucher program regulations, also a TA provider as it relates to HCV utilization to a variety of PHAs across the country. I specialize in pretty much everything as it relates to HCV, but more specifically Cmap, program administration, project-based vouchers, relocation, as well as HCV utilization. I am a self-described housing nerd, as I like to talk about numbers and utilization. And so if you hear me getting excited as we go through this process, it's because I like to talk about it. So what this notice includes is the continuation of already available waivers that are available to PHAs, which includes using the EIV for income verification. It continues the allowability of remote video HQS inspections and PHA oral briefing. So those are all things that PHAs can continue to do through the normal business of administering programs. Oral briefings include phone briefings, webcasts, in-person or other virtual methods are still acceptable forms as it relates to oral briefing. So high-level summary of the notice. So again, it's PIH Notice 2021-34. There are 5 waivers. One allows you to increase the payment standard during the HAP contract term. What that means, high level, is that you don't have to wait for a change of unit or an annual recertification to increase the payment standard of your program, of your families as they're participants in the program. Generally, payment standards are applied through change of units, new admissions, or annual recertifications. However, Waiver 1 allows you to implement a higher payment standard at any time during the HAP contract term. Number 2, waiver number 2 relates to Cmap. So if you are anticipating to have to complete a Cmap certification this year, through the PIC notice and the waivers that are available to you, you can request to waive the requirement to certify your Cmap score in 2022. The term, waiver 3 is in relation to the terms of the voucher. It allows you to extend the term of the voucher beyond what your current administrative policy currently says. So if your current policy allows for the term of a voucher to be 120 days maximum, the waiver would then allow you to extend the term of that voucher beyond those initial 120 days. The 4th waiver is pretty self-explanatory. It expands the maximum term of assistance through the home ownership program by an additional year. So instead of having, a certain, I think it's 15 years for home ownership, it allows you to extend it for an additional year. And then voucher tenancy, it's related to a new payment standard amount. So you can create a payment standard if you would adopt this waiver to increase the FMR to, instead of being limited to 90 to 110%, it allows you to expand the payment standard to 120% of the FMR. And so we're going to dive into these 5 waivers and talk about their applicability as it relates to this PIC notice. And so the one thing to keep in mind, and this is very important, is the request for an expedited regulatory waiver must be received on or before March 1st, 2022. And shockingly, January is already gone. So we are down to 28 days to submit this waiver or submit for any of these waivers if you wish to have it expedited for processing. You can apply for these waivers after March 1st. However, they won't be expedited as they would be if they're received before March 1st of 2022. For PHAs to apply for these waivers, they must provide justification for why the waiver is needed, the impact it will have on PHA operations, as well as program utilization, as well as the proposed duration of the waiver not to exceed December 31st, 2022. I know you were all thinking maybe we could get Cmap waived until 2024, but that's not the case. These waivers will end at the end of 2022. So keep that in mind. Examples as it relates to justification for requesting waivers would be if your jurisdiction has increased vacancy rates, also known as decreased utilization of your vouchers, if you have insufficient staffing to address administrative backlogs or maintenance backlogs, if you have potential negative impacts to tenants or onset of housing instability. I think we all kind of have a good idea on what's going on in the market right now. Each market is unique to its jurisdiction, but kind of from a national perspective, you see and hear the price of rent or the cost of rent continuing to go up across the country. In terms of local pandemic or specific delays or limitations that are caused by supply chain disruptions, safety or other social distancing requirements would be justification, as well as if your Cmap indicators were affected directly or indirectly due to disruptions in PHA operations caused by the adoption of the CARES Act waivers that were allowable back in 2021. And so we'll kind of dive into some of those as we go through this as well. Additionally, if you are looking to apply for Waiver 5, you're going to need additional justification. The PHA to submit for this specific waiver would be required to certify that it meets one of the following good cause reasons. So there's 3 different reasons why you can justify the need for Waiver 5. One would be if your FMR is determined to have a significant rental market fluctuation, which would be, it's included in the notice. It allows you to, it doesn't allow you to, it's included in the notice, and there's a list of 227 different PHAs who are listed in that notice who would automatically qualify for Waiver 5 justification. Utilization rate, so if your utilization rate is below a certain percentage, it would be justification of Waiver 5, or if the timely leasing of your vouchers is below a certain percentage. And we'll get into all of these a little bit more at the end of the presentation as to how exactly to apply for these things, and more of a definition of what they exactly are here coming up in the presentation. And so now we're going to dive into these 5 regulatory waivers. The first waiver is the payment standard increase during the HAP contract term. And so PHAs for Waiver 1 have the option to increase the payment standard for families at any time after the effective date of the payment standard increase, rather than waiting for the next regular annual reexamination. For example, if you apply for this waiver and you're approved, a PHA can implement the updated payment standard to allow all current families with an effective date following the approval of the waiver. What that really means is if you apply for the waiver in February, you are approved for the waiver in March, it would mean that you could potentially increase the payment standard for all of your participating families at any point after approval of the waiver. And we'll get into why you might want to do that. There's some great reasons to do that, and we'll be talking through that here shortly. A little background, as you all know, payment standards are generally set between 90 and 110% of the FMR or the small area FMR for that specific jurisdiction. Payment standards for 2022 were published in October of 2021. I have a link here in the presentation that you would be able to click on to access what those 2022 FMRs are. Additionally, payment standards for small area FMRs, PHAs could additionally find it beneficial to utilize small area FMRs, which are based on zip codes, where some areas in different jurisdictions have higher costs than others. And so it may be an opportunity for PHAs to look at small area FMRs. Additionally, that was published in 2022, or in October of 2021 for 2022, with a link in there as well. So the question you might be asking is, hey, Mike, why do payment standards matter? And the reason they matter as it relates to utilization of your program and as it relates to the number of families you serve and the impact it has on the families is the payment standards determine the maximum amount of subsidy that a family can receive. And generally, when you're looking at your payment standards, a lot of PHAs are increasing their payment standards as the rental markets are generally going up across the country. And so if you increase your payment standards, generally, your per unit cost, also known as your PUC, goes up. And the PUC, or per unit costs, are something that is monitored in the 2-year tool. And so I am a huge fan of the 2-year tool. I think it is absolutely needed by PHAs as they are going to determine if they want to utilize any of these waivers. You need to really start to crunch the numbers and analyze data and information through the use of the 2-year tool. And so generally, when payment standards go up, your HAP expenses go up as well. And why is that important? So As of December 20th, 2022, HUD had a HCV total reserve balance of $2.5 billion. And what this is this is a summary from the Hcv dashboard. And what the dashboard shows is the outstanding reserves that PHAs had across the country for the utilization of voucher programs. If you want to kind of look through the summary page, kind of the key things is, okay, this is what the HAP reserves are, and it equates to the under leasing or the leasing potential to house an additional 121,000 families based off of this data. And so according to the dashboard, the 2.5 billion in reserves at the end of calendar year, there's the 121 unutilized vouchers. And so increasing the payment standard is an opportunity to allow PHAs to utilize more of those vouchers through a variety of different means. Before I kind of launch into some more of this Waiver 1 stuff, it's important to understand that Waiver 5 also is related to your payment standard. And so when you're thinking about these waivers, and as we kind of go through this, the keys to thinking about these waivers is, why would you want to do any of these things, right? Why would you want to apply for waivers, or why would you want to implement them? And because Waiver 1 and Waiver 5 are both payment standard related waivers, the payment standard is going to set that maximum amount of HAP subsidy that a family can receive. And so when you're looking at your program, your HCV program, the first thing you want to look at is, as it relates to the families that you have on your program, and what percentage of them or what number of them are rent burdened, which means what percentage of your families or what amount of your families are paying more than 30% of their income towards their rent. Because implementations of either Waiver 1 or Waiver 5 will impact the amount of rent that families are required to pay. And so when you're considering these waivers, right, Waiver 1 and Waiver 5 have a direct impact on the rent burden of the families that you're providing housing to. Additionally, if the implementation of Waiver 1 or Waiver 5 will impact the potential utilization based off of the market conditions within your jurisdiction, because payment standards, as they go up, can expand the amount of participation from landlords in your program. So when you're considering these waivers, Waiver 1 or Waiver 5, the first thing that you need to determine is this right for my PHA? And so the best way to determine if you want to consider these waivers is to determine what your HAP reserves are, to see if you can afford it first. And so, as I said earlier, I'm a huge fan of the 2-year tool. And so I highly recommend opening the 2-year tool. And when you do, you're going to see the summary outcome section in the top right-hand corner of that tool. And so in this example on your screen, this example is showing this PHA in 2021 had a HAP reserve of 21%. And in 2022, they have an anticipated HAP reserve of 19.2%. So you need to be aware of how much funding you have available to you for your program, because implementing higher payment standards potentially is going to reduce what HAP reserves you have, because you're going to be expending more cash on your HAP. And so one of the things I like to do to determine if because I work with a lot of PHAs, one of the first things I do when we're talking utilization is I determine if they have sufficient HAP reserves to lease up all of their families. And so in this example that you see on your screen of the 2-year tool, and I'll just give you a quick refresher on the 2-year tool. So UMAs is your unit months available. That's how many total vouchers you have available to you. Your actual UMLs are the unit month lease. That's how many vouchers were leased in that month. Actual HAP is the amount of HAP that you expended in those months for your UMLs. And then your vouchers issued or projected to be issued are the number of vouchers that you issued in those specific months. And I kind of hid the section or the column next to it, but that's that column is additions or subtractions to your program. And so those are immediately utilized vouchers in that column. And so in this example, what I did is I entered in 50 vouchers leasing up in the month of January, so that I'm projected to have leased all of my vouchers by January. And so I've covered up some of these other columns that are calculated fields. So I'm not going to really go through those, but you've got these 50 vouchers here that we are saying they automatically leased up. And so what I'm doing is I'm fully utilizing my program so that I can see if I have sufficient reserves for what I'm trying to do. And then as you come over, one of the most important columns is your PUC and your actual PUC projected, followed by your manual PUC override column. And so you'll hear me talk about PUC all the time because it's pretty much one of the most important things you can look at, and you need to have a good eye and analysis for what that is and where it's going. And so for this example, I'm projecting that the PUC for this specific PHA is going up by $6 a month for all of 2022, based off of analysis as it relates to an increase in the payment standard for this specific PHA. Because what likely happens when you increase your payment standard, your HAP expenses go up, and therefore your per unit costs go up, or your PUC goes up. And so in this example, we can see if this PHA were fully utilized in January, knew its PUC was going up by $6 a month throughout 2022, and then looking at the 2022 year-end reserves, they're still going to be they'll still have $400,000 left in HAP reserves. And so through this little exercise, you can see that this PHA has sufficient reserves in their account. Now, I will stress this is if you are not using the tool or you're not familiar with any of these terms, I'm going to recommend that you reach out to your field office and work with them on this stuff. They are extremely helpful and can help you, review what's going on with your program to determine what's best for you. In general, I would say call your field office all the time, because they're there to help you. It's a partnership, and it's really important that PHAs work with their field office through all of this, through this process, so that you can make sure that you're on the right track and that they can pull you back from doing something that you might not want to do. So please reach out to the field office if you have specific questions as it relates to pretty much anything. But also as it relates to the 2-year tool, if you need help with that, please make sure you reach out to them. And another example, and what we're going to do here is we're going to go through what would happen if we implemented Waiver 1 for this PHA. And so we're looking at 2021 with our unit month available, our unit month lease, and our actual HAP. These are the vouchers that were issued in 2021. In 2022, the PHA is anticipating to issue a specific number of vouchers every month throughout 2022. And then are anticipating, there's 11 in here because they're anticipating leasing project-based vouchers throughout the year in 2022. And so the PHA here has analyzed their PUC going into 2022 based off of increased payment standards, and we're factoring in a $5 increase per month on their PUC. So the PHA is issuing for 2022 900 vouchers, leasing 120 project-based vouchers, and they're anticipating that their HAP reserve is going from $4 million in 2021 to $3.2 $2.25 million in 2022. And through this process of projecting what's going to happen to your program as it relates to your reserves, it gives you additional information in the tool. So in the top right-hand corner of the tool, there's information about your ACC funding. And so what you see here, quick little tutorial, right? You've got your 2021 year, your 2022, and your 2023. Based off of their current year expenses in 2021, they are anticipating an offset of HAP reserves by $600,000. However, based off of their anticipated leasing in 2022, their offset would be reduced to $279,000 in 2023. And so in looking at Waiver 1, what it really allows you to do is take your increased payment standard that you implemented in, October, November, December, January, whatever month you implemented your payment standard. It allows you to take that payment standard increase, and instead of just doing it at your annuals or with your new admissions or your change of units, it allows you to do an interim to increase your payment standard across the board for all of your families at that point. And so when you're working in your tool, this PHA here, in this example PHA, we're still issuing the 80 and 75 vouchers a month, and we're still leasing up 11 PBV units every month. But what we're doing over here on our PUC is, instead of waiting until December for our PUC to get up to 518, we're implementing the payment standard in April. And by implementing the payment standard in April, it's increasing our per unit cost to $518. And so what that really allows for is, it allows all of those families, because really what's happening is you have a lot of families. If your PUC's increasing from your payment standard going up, it means you have a lot of families who are rent burdened. And when you have a lot of families that are rent burdened, as your payment standard increases, your HAP expenses go up, and therefore your PUC goes up. And so by implementing Waiver 1, this PHA is reducing their total HAP reserves by the end of 2022 to $2.4 million, as opposed to, I think it was previously 3.2. So there's a significant reduction there in the total HAP reserves of that PHA. What that equates to is, if we would implement that waiver, or if that PHA would implement that waiver in April, their offset going into year 3 reduces to $60,000. And so implementing the payment standard across the board will reduce that PHA's offset potential in 2023 by $219,000, while it can still issue the same number of vouchers planned, while reducing the rent burdens of those families that they're providing housing to. Reducing that offset will allow that PHA to maximize the number of families that can be housed in the future, as well as potentially increase future admit fee potential by having that HAP funds available, by not being subject to as much of an offset. And so before I launch into kind of Waiver 5, as it relates to Waiver 1, and I'll talk about why you might want to do this and what some of the barriers might be and things like that. But as it relates to Waiver 1, implementing this for your program, that the main thing to take home with this is, you can reduce the percentage or the total number of families that are rent burdened in your program. And that is very important, especially when the price of affordable housing and the price of rental units in general continue to rise. So this could be a serious way to reduce the burden that your families are currently facing as it relates to the rental market. Okay. So Waiver 5. So PHAs may request an expedited waiver to allow for the establishment of a payment standard between 111 and 120% of the 2022 FMR or small area FMR. To request this waiver, the PHA must justify this request, and I'll talk about that at the end of the presentation. The PHA must revert back to 90 to 110% of the 2023 FMR, or may apply for continued use of 120% of the FMR with a regular waiver request. And there's instructions in the notice. So I'll summarize that. You can potentially increase your payment standard to up to 120% of the 2022 FMR. However, if you want to do it and use the higher percentage in 2023, you're going to have to get a new waiver next year for that. So first thing, you're going to do the same exact thing as you did with your payment standard analysis for waiver 1 is you need to figure out if you can afford that. So prior to your submission of the waiver request, the PHAs must determine the budgetary impact of the implementation of this waiver to ensure you have available budget authority that's required to support the increases in payment standards. And I recommend the use of the 2-year tool, or sorry, not the 2-year tool, the tool of tools. And there's a link in there. If you've never used the tool of tools, it's on the same web page as the 2-year tool. But what the tool of tools has in it is a payment standard analysis opportunity to where you can enter in what your current FMRs are, what your current payment standard percentages, and then determine what would happen if you increased your payment standard to 120, 115, 110%. You can run various calculations. And what the tool of tools will do is it will help you determine your PUC or your per unit cost at different points in the future based off of a higher payment standard. And it's very important information to gather when you're trying to determine if you should use Waiver 5. So again, you're going to determine if you have sufficient HAP reserves. This is the same example that we used on the previous slide. It's our PHA. We're fully utilizing this PHA's voucher program, using their 110% of their FMRs for 2022 as their payment standard, and ending with a HAP reserve of $400,000. And then we're taking this PHA, and instead of using 110%, we're looking at implementing 120% of the FMR here starting in May of 2022. So instead of this $6 increase per month, we're now seeing a $15 increase per month as it relates to that housing authority's per unit cost. And what we're seeing is, we were on the prior slide, we were at 10% of HAP reserves by the end of 2022. And then by implementing 120% of the FMR, we're now down to 6.1% in the HAP reserves by 2022. And the reason our HAP reserves are going down is because it's directly related to the number of families that you have on your program that are rent burdened. Because your HAP reserves or your per unit cost won't go up unless you're spending more in HAP. And your HAP costs won't go up unless your families are rent burdened. And so knowing how many families you have that are paying over 30% of their income towards their rent is extremely important to understanding the impact that increased payment standard would have on your program. The final slide here shows, do you have sufficient HAP reserves? And so what I'm doing here is when we, if we analyze the 120%, and instead of going up by $15, it's going up by $20 in our per unit cost to 120%, this specific PHA would find themselves in shortfall through implementing 120%. And so it's extremely important to analyze that data as it relates to your per unit cost of your program, because you could overspend. and you certainly don't want to do that either. The other thing I'm not showing you here in these slides as it relates to the 2-year tool is there's a tab at the bottom that says years 3 and 4. And so whenever you're projecting what you should do for your program is to always look at what you're doing in 2022 as well as years 3 and 4, because what you decide to do could impact your HAP reserve status going into 2023 or 2024. And so you're going to want to make sure that you're looking at that additional worksheet at the bottom of that 2-year tool. And so the question you ask yourself is this right for my PHA? You need to determine if your rent reasonableness, so some things to consider, right? You need to determine if your rent reasonableness supports amounts that exceed your payment standards. Looking at your rent reasonableness methodology will allow you to set your rent. So as you're going through the process of looking at payment standards and analyzing data, it's going to be extremely important to be looking at rent reasonableness as well to make sure that if you're increasing the payment standards of your program, your rent reasonableness process is reflective of the current market and continues to be compliant with your administrative plan. And I say that to say increasing the payment standard, the number one thing for, or number one reason for increasing the payment standard is to reduce the rent burden of your families. However, if you don't have a lot of families that are rent burdened in your current market, you might want to take a look at your rent reasonableness to make sure that it's competitive with where prices are set at in the current market as well. Another question for a PHA to ask themselves is, if your success rate is very low, you can consider this as an option. Increased payment standards reduces that family's burden and increases the amount that the landlord is guaranteed if the family is rent burdened. Success rates also that are very low should be considered because you want to review that rent reasonableness to make sure that your comparable units support your current market conditions. If you're, and I think I mentioned this on the previous slide, if your rent reasonableness is approving rents at $900, but your payment standard is $1,000, you need to make, and that's what the market is, you need to make sure that your rent reasonableness or the way that you do rent reasonableness is competitive with the current market conditions in your jurisdiction. Additionally, you need to, when you look at increasing the payment standards, you need to make that public knowledge. If you want to increase landlord engagement and participation, letting them know that, hey, we're increasing our payment standards, your units might be supported at the rents that you're asking for now on our program based off of these changes that we're making, is a great opportunity to increase the number of landlords that are participating in your program. Another thing to think about is if you are in a PHA that's in a shared jurisdiction. So if you're a county housing authority and you have multiple cities within your jurisdiction and you're all allowed to use your vouchers in either one's jurisdiction, you need to make sure that the payment standards are not lower for one jurisdiction than they are for another. So if you've got 3 PHAs in the same jurisdiction and you're all allowed to use your vouchers in any of those jurisdictions, you need to make sure that one housing authority doesn't have a competitive advantage against yours because your payment standard is set too low. And so have a conversation with any PHAs who might be in this situation to make sure that you're not at a disadvantage as it relates to that, because you want to remain competitive in the market. And if your voucher is not worth as much as somebody else's, then somebody else, some other landlord might be going to a different PHA to accept vouchers. Another thing to consider, if it's right for your PHA, is if you're a PHA that experienced a decrease in the FMR in 2022. And so if you, and I know there's several across the country, several PHAs across the country who did experience this, and it's not necessarily reflective of what their market actually is. You may want to consider Waiver 5 specifically to increase your payment standards back up to where they were in 2021 or higher. It should allow you to continue to retain landlords on your program. It should allow you to continue to expand the availability of units within your jurisdiction, and it will also potentially continue to minimize that family's rent burden, because if the payment standard goes up, the family's portion of rent, or if the payment standard goes down, the family's portion of rent potentially goes up, and specifically in rent burden situations. And so it might be a good idea for any PHA out there who experienced a decrease in the FMR in 2022 to consider Waiver 5 as an opportunity to continue to provide housing, minimize rent burdens, things like that for your program and your jurisdiction. So the final option is implementing Waivers 1 and 5 together. And so again, Waiver 1 allows you to implement a higher payment standard at any point across the board for all of your families. Waiver 5 allows you to take it to 120% of the FMR. And so in our 2-year tool example here, the use of Waiver 5 to increase payment standards to 120%, the use of Waiver 1 to implement interims here in the month of June. We've analyzed the increase in our PUC to 886 and implemented those higher payment standards here in the month of June, which is taking down our HAP reserves and therefore validating that, yes, we could afford that. Now, the caveat to that is, notice here on our tool, we're not projecting to issue any additional vouchers, and we're not leasing any PBVs or any anticipated leasing. So if you were to implement Waivers 1 and 5 together, you do want to make sure that you still have the ability to do some leasing of your program, because if you're not leasing, your program is just shrinking, right? Because you'll just be losing vouchers without replacing them, and therefore lowering the amount of administrative fee your PHA can earn through the program, because you just decided to, implement 120%, do Waiver 1 all at the same time, and now you're not issuing vouchers. It might sound like a magic bullet, but it also does not expand the availability of affordable housing within your community, because you're not issuing any additional vouchers. And so that's something to consider as well. And so again, I'll just reiterate, it's so important to run your program through the tool so you can look at these different options and talk to your field office and ask them for help if you need it. Ask them or have a conversation with them as it relates to implementing these things, and so that you have a good understanding of what's going on with your program and how to proceed forward. The voucher program is a business. If you would just implement Waivers 1 and 5 and not issue any additional vouchers because you're going to spend all of your cash that way, you need to understand that the repercussion of it is you're going to have less administrative fees rolling into your program. And so unless you're intentionally trying to shrink your program, you need to make sure that you analyze what's going to happen to your program upon implementation of either of these waivers. And so when implementing Waiver 5, consider that in 2023, those payment standards are going back down to the standard range between 90 and 110%, unless the waiver is approved to use 120% through the regular waiver process. Additionally, when payment standards decrease, they cannot become effective until the second annual reexamination unless through a new admission or change of unit. So if you would implement Waiver 5, know that in 2023, if you don't go through the normal waiver process for approval of 120%, your payment standards are likely to go back down within that standard range of 90 to 110, which is going to result in the whole second annual recertification process. Additionally, implementation will need to be evaluated as it relates to the impact of operations. And so we'll talk through that here in a couple of minutes too. Kind of as it relates to waivers 1 and 5, what you can, well, specifically for Waiver 5, and well, actually both, what some of the pros are is you should be able to get higher success rates on your program. And what I mean by that, success rate is another thing that's trackable in the 2-year tool. So you can see out of how many vouchers that you issued, how many of those vouchers successfully leased up. When you're increasing your payment standards and you're informing landlords, the potential of increased success rates is high. By increasing your payment standards and preserving the offset that you could potentially face, you could have increased administrative fees as it relates to not having to deal with an offset, as well as increased administrative fees because you're leasing more, because you have higher payment standards and potentially higher rents as a result. You're going to house more families because you have more opportunities for families by having a higher payment standard in different areas of your jurisdiction. It opens it up. The big one is decreasing that rent burden that families are facing. For those families that are over 30%, you really want to try and focus in to decrease that rent burden by increasing that payment standard. You can get more landlord participation by being more competitive in the market and having a higher payment standard, as well as spending that excess revenue and reducing potential offsets. The kind of one of the cons as it relates to this is the administrative impact that it has to potentially decrease payment standards in 2023, meaning having to track that second annual re-exam process for decreased payment standards. Sometimes it can be a bit of a burden depending on the software that you use in your system of record, but it's something that is worth keeping an eye on as it relates to that change. And then finally, is this right for my PHA? So if you're considering Waiver 1, you're implementing that payment standard all at the same time in one specific month. So if you're a PHA that has 100 families on your, 1,000 families on your program, your PHA would potentially need to conduct 1,000 interim recertifications to implement Waiver 1. Additionally, PHAs have the option to increase the payment standard because PHAs have the option to increase the payment standard at any time after the effective date rather than waiting for the next annual re-exam. So you might be like, Mike, that's crazy. We can't process 1,000 re-exams for all of our families all at the same time. Well, we can look at it a little bit differently. Out of those 1,000 families, well, so you start with the analysis, right? Out of your 1,000 families, how many of them are rent burdened, meaning their payment standard is less than the gross rent of their unit, therefore the family's paying more than 30% of their income towards their rent. If you're looking at a 1,000 family program and you have, say, only 200 rent burdened families, you wouldn't potentially need to conduct 1,000 interims all at the same time, because the only families that would be impacted would be those who are rent burdened. And so by analyzing your data, you can see how many interims you would actually need to do. So before you're like, no, that's crazy, analyze your data and see what that actually means to your PHA. The other thing to consider, and I don't know how feasible this is, so I'm just going to throw it out there, but you could consider having a conversation with your system of record provider, right? So whatever software you're using to conduct your and complete your 50058 transactions, and have a conversation with them to determine if if the software company is able to in some way automate the completion of 1,000 interims by just changing the payment standard. And so you might be like, Mike, that's going to cost me an arm and a leg and blah, blah, blah. If you do the math, it might be worth it to have that conversation with your software company to see A, if it's feasible, and B, how much it's going to cost. And then analyze if it would cost you more in staff time and hours to implement, or would it cost you more to have the software company do it for you. Now, every software company is unique and different, and so I don't know what is and what isn't feasible as it relates to this, but it's worth a 20, 30-minute conversation to see if that is an option for you. And so as we wrap up Waivers 1 and Waivers 5, the questions you need to ask yourself as a PHA is, do I have the reserve balance to afford this? The second thing is, will it make a difference for the family? So what percentage of your families are rent burdened is extremely important to know in understanding if this is something your PHA should consider. Will it move the needle? Will it move the needle as it relates to the utilization of your program? Seeing if you're going to get up to, reducing, or seeing if you would be able to reduce that HAP reserve by providing more subsidy to those families is something that you need to consider. And then, do you have the capacity to do it? And when I say do you have the capacity, you need to analyze how many of those families are rent burdened and how much work is going to go into it. And then see if there's any automation that's available to your PHA through your software provider to see if they can make that easier. So those are really the 4 main questions as it relates to Waivers 1 and Waivers 5 that you need to consider as you're considering what to do with your program as it relates to these specific waivers. All right, so Waiver 2. Waiver 2 is Cmap. So this waiver allows PHAs with fiscal year ends in March, June, and September the opportunity to request to waive the application for Cmap. If the PHA has Cmap indicators affected, or if and only if the PHA has Cmap indicators affected directly or indirectly due to this disruption of operations caused by the adoption of available CARES Act waivers. So what that means is, did you as a PHA implement COVID waivers from PIC Notice 2021-14 that would affect 2022 Cmap scores? A couple examples of that would be, did you implement waiver Hcv 2, which allowed you to delay the annual reexamination for those families? If you adopted that as an agency to compensate for transactions that were processed late due to the pandemic, it would impact your ability to meet Cmap indicator 9 and therefore qualify you as a PHA who could push Cmap off for 2022. Another option, if you implemented HQS Waiver 5 related to the delay of annual inspections or the completion of quality control inspections, you would be able, where you didn't physically inspect those units and you delayed them until later in 2022, you would qualify for to apply to have your Cmap score pushed out until 2023. Additionally, and as a reminder, in the absence of waivers or eligibility for small PHA deregulation, all PHAs are subject to Cmap scoring in calendar year 2022. Small PHA deregulation applies to PHAs with fiscal years that are ending in March of 2022 and May of 2022 that are not designated troubled and have less than 250 vouchers under their ACC. So if you're a small PHA and you're on a biannual Cmap scoring cycle. If you are not going to be scored in 2022, then you do not need to worry about applying for that specific waiver as you are being skipped this year. Before I go into the next one, next waiver, talking about Cmap, I will say this, is Cmap for a lot of PHAs hasn't been scored in a while now due to COVID and other things. Well, not other things, really just due to COVID. But I would highly recommend that if you're looking to kick Cmap down the road for another year, that you still do an internal Cmap audit on your own. If you're approved for the waiver for Cmap, still do it internally so that you can see where your program's at. Because once 2023 rolls around, knock on wood that everything is good and we're not talking about waivers again next year, Cmap's going to come a knocking, and you don't want to be rusty on how to actually do it. There's a lot of turnover in the industry right now, in the housing industry, and so it's important to make sure that you don't lose institutional knowledge for your PHAs as it relates to Cmap. And so I would highly recommend that even if you're not submitting Cmap and you're getting the waiver, still go through the process of scoring your program. Because if you go 2 years without scoring your Cmap and without even dealing with that, when it comes time to do it in 2023, it could be a very sketchy situation. And so, just reiterating, I would go ahead and score my Cmap internally if I were any PHA right now, so that I'm not caught by surprise in 2023 because I haven't looked at Cmap in 2+ years. All right, I will get off of my soapbox for that, but I think it's extremely important for all PHAs to consider moving forward. As it relates to Waiver 3 and the term of the voucher extension, so it allows PHAs to grant a family one or more extensions from the initial voucher term, regardless of the policies described in the administrative plan. The PHA should ensure consistency with these requests and remain in compliance with the informally adopted interim standards. So if you ask for and are granted this waiver, it allows you to trump your admin plan as to what it says in regards to the initial term of the voucher and the number of extensions that you're granting. And so things to consider, is this right for your PHA? So one thing to look at is considering your success rate of your program and how often you're granting extensions. What I have up on the screen here is from the 2-year tool. This is the success rate tracking tab. And so I highly recommend all PHAs use the success rate tracking tab because it's extremely helpful. But look at your program to see how long it's taking families to actually locate units. If families are having a difficult time, you want to consider this waiver to extend the length of that voucher beyond the terms that are listed in your administrative plan. This is a great opportunity to talk with your field office for perspective, as well as assistance if you need it with tracking the success rate of your program, because it's an extremely important and often overlooked part of planning as it relates to the use in the 2-year tool. Another thing to consider in regards to Waiver 3 is if your PHA is in a difficult market, you may want to consider extending vouchers for a longer period of time. So in a very tight market, available units are leased up extremely quickly. If a family is stuck there waiting for a PHA to issue extensions, they may be missing out on getting a voucher leased. So extending vouchers for longer periods can potentially allow families to lease up, specifically in very tight markets where a unit is listed one day and it's gone the next. If a family's waiting on a document from the housing authority to show that their voucher's been extended, that can result in that family missing out on an opportunity to receive affordable housing because you have a process in place that is creating a barrier for that family to utilize their voucher as quickly as they can. Another consideration is the impact it has on your success rates in terms of tracking your success rate in the 2-year tool. And so a quick summary of how the success rate tracker works in the 2-year tool is it's tracking the success rate of the vouchers that you have, all of the vouchers you have issued on a monthly basis, and then all of the vouchers that are not successfully leased. So if you would implement Waiver 3 regarding the extension of the voucher, it may impact your ability to have up-to-date success rates because you're pushing those vouchers out instead of 120 days. It's now on issue for 280 days, which could mean that your success rate tracking is going to look, it's not going to close out because you haven't really closed out that potential voucher. So keep that in mind. And if you need help in tracking it a little bit differently, contact your field office for assistance as it relates to that. And then kind of the last thing is talking about your PHA's capacity to extend vouchers, right? Similar to payment standard conversations, you have the staff who has the capacity to process a bunch of interims. What I kind of see across the country is housing authorities issuing vouchers, and there's a lot of vouchers on the street. There's a lot of saturation in the market. And if you're not issuing vouchers with long enough time periods, you're going to be reissuing that voucher and extending it again and again and again. And what is your staff's capacity to continuously extend vouchers? If you're not issuing a voucher for a long enough period because you know it takes a while for a family to find a unit, then you're going to find your staff doing it again and again and again. So if you're implementing that waiver, you need to look at how long you're extending that voucher for, because it can be frustrating as someone who was once a frontline PHA person to issue the same voucher 8 times over an 8-month period if you adopted this waiver, because you're constantly requiring families to extend that voucher. And then the other thing is, what is the success rate based off of your current extension policies? And so there's always talk about, should you issue a 60-day voucher, or 120 days? What's more effective? Some PHAs would do a 60-day voucher to encourage families to find something quicker. Some PHAs give a 120-day voucher so that they're not having to extend it twice after that. So really think about how successful your program is and what your success rates are based off of your current voucher issuance policy as it relates to the length of time you issue it and your extension policies, and determine if you're adding any value or if there's any value being added to that policy as it relates to the extension of that voucher. And then Waiver 4, this one is pretty self-explanatory. It's home ownership, where you can increase the maximum term assistance for participants in the program on home ownership for up to 1 additional year. So it allows you to continue to provide home ownership assistance for that family for 1 additional year. It's pretty straightforward. So how do you apply for these waivers? So a PHA may request a waiver based off of the HUD requirements, and should include justification that documents why the waiver is needed. No waivers requested may be implemented unless written approval from HUD has been obtained. So don't implement any of these until you're allowed to. To ensure expedited processing, a PHA should email its waiver request to PIH_expedited_waivers@HUD.gov with a copy to the local field office's public housing director. So don't apply for waivers without letting your field office know. It's important that you work with your field office so that they can help you, and they can help you make good informed business decisions for your program. And so it's extremely important that you copy your local field office director when you're applying. In terms of what you need to do for the requirements of waivers 1 through 5, so in your email, your subject line is going to be Expedited Pandemic Regulatory Waiver Request, including your PHA name and PHA code. The body of the email should include the PHA's address, name, and point of email for point of contact, the name and regulation from the chart of the 5 waivers that are being requested. So in the notice, there's a chart, and so you need to list which of those waivers you're requesting, and then PHA specific justification for why these waivers, extensions that show good cause. So you need to provide justification of why you're requesting those waivers. As it relates to Waiver 5, as I touched on at the beginning of the presentation, the PHA must also certify that it meets one of the following good cause reasons for requesting Waiver 5. Waiver 5 is the payment standard increase to 120% of the FMR. So here's your 3 reasons, right? In the notice, it's got a list of 127 PHAs that HUD knows have significant rental fluctuations where an increase in the payment standard up to 120% may help the PHA more quickly respond to local circumstances. So that list of PHAs is directly in the notice on the last page. Utilization rate. So if your utilization rate is lower than 98% of the current year-to-date, or more than a 5% reduction in utilization rate occurring between 2019 and 2021, the utilization rate is the higher of, again, the utilization rate as you look at your tool is the higher of the unit month lease divided by the unit months available, or the total HAP spent divided by the budget authority, including reserve. And so if you have a utilization rate of your program that is under 98% for the current year to date, or more than a 5% reduction, you would be eligible for Waiver 5. And lastly, timely leasing of vouchers. If less than 85% of the vouchers that the PHA has issued in the last 6 months have leased, meaning this would probably account for the majority of the PHAs that I've talked to. I think there's a few that I've worked with that are over 85%. But if you have an over 85% success rate, you wouldn't qualify under item 3. But if your success rate is less than 85%, you would qualify under that justification for Waiver 5. After application, and following submission, PIH will reply via email confirming that the request has been received. The PIH program office will prepare a final determination for approval by the assistant secretary, and then PHAs will receive a signed response to the waiver via email and letter. And so it takes us to what are the next steps, right? So you've listened to me talk for an hour and 15 minutes, an hour and a half. So what do you need to do as a PHA? And so the first thing you need to do is analyze your data. And what this means is look at your system of record, whether that's Yardi or Emphasis Elite or MRI or whatever your software might be, and see how many families you have on your program that are rent burdened. Meaning those families are paying more than 30% of their income towards their rent. That's step 1. Step 2 is utilize the 2-year tool. See what your available HAP is. Not just the HAP that you have coming in annually, but your total reserve. Get a good feel for where you're at financially as it relates to your HAP. And then finally, using the tool of tools to determine what your per unit costs are if you were to increase your payment standards for your program. The tool of tools can analyze that data for you Now, you can also go old school and run a report and do some Excel stuff to determine what your per unit cost will go up by. But if you utilize the tool of tools, it can certainly make that a bit easier for you. There is a little bit of a learning curve, so there's instructions in there. But if you have questions as it relates to that, or any of those decision points in terms of your data, please discuss that with your field office. Your field office is there to absolutely help you, go through this process and make sure you're able to maximize the value of these waivers for the families that you're serving. In terms of kind of after you talk to your field office, you've analyzed your data, you talk to the field office, they're like, yeah, PHA, that's a great idea, let's do this. Then the next step would be to apply for those actual waivers. And once you apply for those waivers, you need to start planning for the implementation of those waivers that you applied for. Finally, once you've implemented your waivers, you need to determine your need for 2023 to request additional or a higher payment standard as a percentage of the FMR going into 2023. You're going to need to justify the need for that, and so you're going to need to start analyzing if you're going to need that higher payment standard in 2023. Midway through 2022, and then discuss that opportunity with your field office as it relates to that there. So those are kind of the next steps as to what you need to do. We're going to open it up to questions, and I think there's a lot of questions that came through as I was presenting, so I'll start there.
Mike?
Yep.
While you're going through that, I wanted to refer them in regards to Cmap. We need you to look at the COVID website resources site with the FAQs that were issued around March of 2021. And it says, OC 87 says, since HUD is issuing Cmap scores beginning with PHAs that have a fiscal year end date of June 30th, 21, does my PHA have to maintain the quality control samples required for many of the Cmap indicators? The response is yes, the PHA must continue to maintain quality control samples. HUD has not waived this requirement or provided waivers for the regulations surrounding these indicators. So just continue to do that. It says, for example, Cmap indicator 1, selection from the waiting list has not been waived, so a PHA still needs to show compliance. So it is required for you PHAs to continue to do your QC, although HUD was not scoring you during that period of time.
Thank you, Velma.
You're welcome.
And that's a great point. So continue scoring your Cmap and doing the QC of it, because it will sneak up on you, right? Don't be that PHA. Velma's saying, don't be that PHA. Make sure you're doing what you're supposed to do. All right. So I'm going to start with the questions that have come in through the chat. The next question is, do most PHAs implement the new payment standards 10/1 of the current year, or is that required by HUD? So different PHAs have different implementation dates of their payment standards. I'm trying to think of what the exact regulation is, but I can tell you this: they don't all implement all on October 1st. There's different periods of time after that that they can be implemented. I think it's within the next or the first 3 months there after they've been posted. All right. For waiver 1, here's another question. For waiver 1, does that mean we can just implement the new payment standards at 120% at each interim certification instead of waiting for the next annual recertification? Or does that mean we need to increase them all at a set date across the board? That's a great question, Tammy, and thank you for asking that. As it relates to Waiver One. So Waiver One is the implementation of a higher payment standard, not necessarily the 120%. So Waiver One allows you to implement, say you're a PHA and you implemented your 2022 FMRs at 110% of the FMR. If you implement Waiver One, you would implement the new payment standard based off of your currently approved payment standard. So it's not necessarily the 120%. The 120% is related to Waiver 5. Waiver 5 allows you to take your payment standard up to 120%. And so if you combine them together, which you can do, you can increase that payment standard to 120% of the FMR and then implement them all at the same time at an interim recertification and not wait for the next annual. And then the other part of your question is, does that mean we need to increase them all at a set date across the board? So if you do Waiver One, you need to pick a date as to when you're going to implement those higher payment standards and then do them effective the same date. If you do Waiver 5, you don't need to, if you do Waiver 5 and not Waiver 1, it means you're increasing your FMR to 120%, or you're increasing your payment standard to 120% of the FMR. Not that you are implementing all at the same time. You'd be implementing them at the annual process. I hope I stated that correctly, and I'll respond to you in writing here in the questions and the answers section too. So hopefully that would make a little bit more sense.
Hey, Mike. One of the parts that I would add to it is to be mindful of the notice, because if I heard you correctly in the question, the individual mentioned something about October, right? So think about it this way. This notice, the term for you implementing the exception payment standards, expires on December 31st, 2022. So you have to look at what is the benefit I'm going to get if I delay implementation until October. Then you've cut the savings that, well, not the savings, the opportunity that you're going to get. So that's why the waiver term has the opportunity for you to implement it and not wait for the normal reexamination period. But consult with your field office to talk it through, because it is a good question that you would want to talk through with your field office, and they will be the best party to guide you to understand the impact, right, and the when, and do that discussion with you.
Thank you, Velma.
You're welcome.
The next question is, if you would submit an interim for a change, would they then not receive the increase until the annual recertification? Okay, so actually this is a continuation of the other question. So for Waiver 1, does that mean we can implement the new payment standard at 120% at each interim certification instead of waiting for the next annual? And then, or does that mean we need to increase them all at a set date across the board? Or meaning that if they did not submit an interim for a change of family composition, income, rent increase, they would then not receive the increase until the annual research. So to answer your question, if you implement Waiver 1, you would implement a higher payment standard all at the same time, regardless of a family composition change or change in income or a rent increase. If you don't implement Waiver 1 and you implement Waiver 5, Waiver 5 would simply allow you to increase your payment standard to 120%, and you would keep your same process. So you would keep your same increase process at the next annual. You would be increasing that payment standard during that time. All right, the next question is, if you raise your payment standard, then need to reduce it next year, do you follow the regulations that require the reductions in payment standards the first of the second annual research? Yes. So if you increase your payment standards to 120%, if you increase your payment standard to 120% in 2022, and then in 2023, your FMR is not within 90 to 110% of what your current payment standard is, then yes, you would need to follow that process of reducing the payment standard at the second annual research. However, when you're going through, if you do implement Waiver 5 and utilize 120% of the FMR, you do need to determine how impactful that is, and then make the decision on if you want to apply for a waiver to increase your payment standards to 120% in 2023. So it's going to be important for the PHA to follow up and analyze the impact of that throughout 2022. There's a question as related to September. Is September 30th included in the year end 2022? I'm thinking your question is related to the Cmap certification dates. Let me go back to that slide. As it relates to Cmap, for a PHA who's got a fiscal year end in September of 2022, yes, that would apply to that PHA. If you have a fiscal year end in September of 2022, that Cmap waiver would apply to you. Another question on Cmap waiver, the PHA rates their issue is lease up. They have a lot of vouchers on the street and no place for them to go due to lack of housing stock, or the unit no longer available or meets rent reasonableness due to price gouging. Is the reason to request a waiver because my lease up rate is a big problem beyond PHA control? Actually, that's an excellent question. And so if you're a PHA who has a lot of vouchers with no place to go and you don't have a lot of housing stock or affordable rent, and your rent reasonableness is not meeting that test because of price gouging, what you really want to analyze is it price gouging or is that what your market is currently set at? If the price of rental units in your market are currently higher than they were 6 months ago or a year ago, it could be something you want to consider increasing your payment standards to accommodate what the current rental market looks like in your jurisdiction. And so as it relates to that question, if there's no places to go for families because of a lack of housing stock or there's no affordable units, you should certainly look at your housing stock and what you're offering for rent to make sure that you have a payment standard that's competitive with the current market. That's a problem in a lot of places, and an excellent question. The next question is, if you have a Cmap waiver approved and if you have a higher score than the internal audit than before, can you submit to HUD to have them change your score even with the waiver? I will refer that to the field office to talk to them about if you have a Cmap waiver but you did an internal review, whether you can still apply for Cmap. So that's something to talk to your field office about. So there was a question here. I don't see the FMRs mentioned in the notice. It's on the last few pages. There's a list of 227 PHAs and jurisdictions that are listed in that notice. The next question is, does a PHA need a waiver for Cmap with a fiscal year ending in December 31st, 2021? And so the waiver for fiscal years ending in 2021 ended or was part of the PIH Notice 2021-14. So if you applied for the waiver, the waivers in earlier 2021, you would have been included in that waiver. Fiscal year ends in December of 2021 are not included in this waiver because they were previously included in the one that was sent out earlier in 2021. Another question is, HUD FMR areas determined to have significant rental market fluctuations. Okay, that's at the end of that notice. It's like the last few pages. There's a list of them. There's a question as it relates to waiver 1. So I thought you said we could do waiver 1 for only the clients who are rent burdened. So that's a great question. Waiver 1 is going to allow you to implement that payment standard all at the same time. And thinking back to kind of what I was presenting is analyzing how many of those families would have a benefit from the implementation of waiver 1. And so when you look at, if you have 1,000 families on your program and 200 of them are rent burdened, you want to implement all of your rent burdened families with, let's just say an effective date of June 1st. And the reason you would want to do that June 1st is, or whatever dates you pick, you would want to do that for all of those families all at the same month, because they would be impacted by that increased payment standard as it relates to rent burden. The other 800 families you would want to implement and do those interims for. However, implementing that payment standard can still be effective June 1st, but it's not going to change anything because their gross rent does not exceed their payment standard, meaning they aren't rent burdened, and it would not change that resident's portion or that family's portion of rent. And therefore, if you had limited resources and capacity to actually make waiver 1 work, you need to see how many families would actually be impacted. You would still make the effective dates of the implementations of those interims the same date. However, it's not going to change for those families who aren't currently rent burdened. I hope that answers your question, but that's a really good question. There's another question for waiver 1. If we apply the higher payment standard, would we have to also update the utility allowance if that has also changed for the current year, or would we still wait to apply for the next annual recertification? So waiver 1 simply says you can increase your payment standard at any point during that HAP contract term. If you implement waiver 1, you do not need to implement the changes in your utility allowance at the same time. Waiver 1 is simply and only for payment standards. The next question is, we process certifications 100 days in advance of the effective date. Does that mean that we can still make use of increased payment standards even though it expires 12/31/22? That's a great question, and I'm going to refer that to the field office. So I want you to reach out to your field office and ask them that specific question as it relates to, if you're doing February 2023 annuals in December, is your question, right? Can you apply that 120% of the FMR at that point? Let's send that to your field office and get a response from them. Approval of waivers by HUD, does that mean the PHA needs board approval and a resolution for that? That's a great question. I would refer you back to your plan or your field office as it relates to whether or not you need board approval for these, unless anyone from the Alabama team wants to chime in on that.
So can you read the question again?
Sure. The question is, approval of waivers by HUD, does the PHA need board approval and a resolution for that?
Okay, yeah, let them consult with the field office. What I could speak to is in our jurisdiction, what PHAs are doing right now. The PHAs are doing the analysis, the executive directors are communicating with the board, and in accordance to whatever policies they have in accordance to the PHA's operating policies, bylaws, and the way they do business, they would communicate with the board, and if they need board approval to move forward, they would go ahead and some of them did special board meetings, got their approval. If that's not necessary at this time, they applied for the waiver after they did the analysis, and then move forward with doing the next steps. But definitely consult with your field office, because each jurisdiction and the PHA's bylaws are different. It's always important to keep the board informed so the board knows what you're doing. So I would say definitely talk it through with your field office and look at your PHA's bylaws.
Thank you, Velma. All right, there was a request for the notice with the with the PHAs listed. I'm going to see if I can post the link to the notice to the entire audience so that you can access it. And then this is the actual notice. And there were a couple of questions as it related to what are the PHAs. So the PHAs listed start after page 9. So here are the 227 PHAs that could be considered for Waiver 5. I put the link in there.
Yeah, and they could go at HUD.gov and look or Google the notice number and just look there, and you will find all the details in the notice.
Yeah. And that's all the questions we have received to this point. If anyone has any additional questions, feel free to go ahead and send them in, and we can take a look at them and respond.
So, Mike, so I just want to talk for a minute, reiterating again on behalf of our Regional Director, Tasha LaSure. This is a great opportunity for PHAs. We have an opportunity to house additional families, increase utilization, and make a difference in the life of the people that we serve. So we encourage PHAs who are listening to evaluate this waiver, have conversations with your field offices, utilize the tools and resources that's available to look at it. This is an opportunity that I've never seen happen before, and also is a great opportunity for you to see the impact and if this makes a difference in your Housing Choice Voucher program, and for you to start to forward thinking of, do I need to, in the future, if this work and I get more landlords, it increase utilization, I probably need to have conversation with my field office to look at, do we need to look at a regular exception payment standard to go beyond levels? So it will open doors for opportunities and future conversations with your field office. Of course, it's something that you have to manage it appropriately, utilizing the 2-year tool to make sure that you're making wise decisions. And as you apply for these different waivers and manage, what I say is that we're in the business of housing families. So managing your PHA as that business of focusing on opportunity to house more families. So just want to thank you all for participating in the training. Mike?
Yeah, thank you, Velma. And at the end of the day, you know, what this is, and to Velma's point too, this is an opportunity for housing authorities to make an impact in the lives of the families we serve. I talk to PHAs all the time about utilization and things like that. And in some analysis that I've done recently with different PHAs, there's a lot of PHAs with a lot of residents who are significantly rent burdened. Large percentages of families are paying more than 30% of their income towards their rent on the voucher program, specifically related as a result of the increased rental market. And so, to Velma's point, this is a great opportunity for PHAs to take a look at what they have going on and make a difference in the lives of the families that you're serving, because it's a very unique opportunity to make an impact in this way. And sometimes this might seem a bit overwhelming, and it might seem like you're being asked to do a lot, but it's absolutely worth it. And it can certainly help improve the lives of the families we're serving. And so I will step down off of my box and say, please apply for these waivers if it's something that your families need, and analyze the data to determine the impact it has. Don't go into this blind and not knowing what the outcome is before you get started. It's extremely important to the future success of your program, and you need to take it really seriously. So I appreciate everyone taking the time to join the call. And there were questions about why there's only 9 pages to the PIC notice. The link I put in the chat gives you all of the additional pages. So you should be able to click on that link, and it would take you to the PDF that will show you all of those pages. The next question is, we have a lot of families overhoused, a legacy of a time when our area had double-digit vacancies. Can we still use these waivers to maintain families who are overhoused in their current unit? And the answer to that is yes. You'll be increasing your payment standard, even if that means maintaining families who are overhoused in their current units. I know that there's some PHAs in some jurisdictions that don't have 1-bedroom units available. And so their only real option is to utilize 2-bedroom units because there's a shortage of 1-bedroom units. And so that would absolutely be an option for those families who are overhoused to benefit from it. I would, so, really all you're doing is increasing the payment standard. If their rent is significantly higher than what your potentially new payment standard would be, they might not benefit as much, but they would actually absolutely be eligible to benefit from that, as different market conditions are different for different areas. There was another question. I may have missed the answer to my question. A PHA is required to implement payment standards effective 10/1 of a current year, or can a PHA choose to adopt a new payment standard effective January 1st of 2021? The question pertains to normal pre and post-COVID practice. So I'm going to go ahead and refer you to the field office for that particular question. So I want you to reach out to your field office and inquire about that one as it relates to that question, Claudia. All right. Another question, so I think this relates back to the overhoused issue. Many of them are 1-bedroom eligible, and our county doesn't have enough units to accommodate them, even without taking plummeting vacancy into account. So yeah, like I said, there's some jurisdictions who don't have sufficient 1-bedroom units available. So increasing the payment standard on your 1-bedroom voucher will benefit those families who are overhoused as well as a 2-bedroom voucher person, a family moving into a 3-bedroom unit. They're still going to get that higher 2-bedroom. If you go to 120% of the FMR, they're going to get that higher payment standard at the 2-bedroom rate, and would benefit from that. It probably wouldn't be enough to cover all of the rent if the 3 bedrooms are significantly higher, but they would certainly benefit from a higher payment standard. Hearing no and seeing no additional questions, we'll go ahead and end the call. I want to thank everybody for being on the call today. I hope you have a great rest of your day, and we look forward to seeing you apply for these waivers. Have a great one.